Compared with other workforce models, the National Fund for Workforce Solutions is better at getting people jobs. That's the central finding of a study conducted by Impact International in Cincinnati, Ohio. How did Impact come to this conclusion? Let's take a few minutes at the whiteboard to find out. In its study, Impact looked at a group of people who would receive training services from the Health Careers Collaborative of Greater Cincinnati, a partner program of the National Fund. Next, it created a comparison group that was demographically similar to the National Fund group. The only major difference between the two groups of people was which organization they received training services from. Using wage record data, Impact International tracked the job status of everyone in the two groups, from the day they first entered either training program to 18 months later. After 3 months, 58% of National Fund program participants had a job, compared with only 44% of participants in the comparison group. That's a 14 percentage point difference between the two groups. These ratios held even after 6 months, 9 months, a year, 15 months, and 18 months. The rift between the two groups held stable too. The National Fund program proved more effective at giving people the skills to get and keep a job. Okay, so those results tell us that the National Fund model gets people employed. But let's set the bar higher. How often did program participants end up not only employed, but employed in the industry of their choice? These are healthcare training programs after all. How good are they at getting people jobs in healthcare? Once again, Impact International tracked program participants using wage record information. And once again, the National Fund proved to be the more effective model. 3 months after program entry, 1/3 of National Fund participants were employed in healthcare, while only 1/10 of the comparison group could say the same. Things looked no different 1 year after program entry. The gap between the two groups held steady throughout the year. Here's another way to look at it. People who entered the National Fund training program were more than 3 times as likely to land a job in healthcare than people who went with the other program. This is a testament to the success of the Health Careers Collaborative of Greater Cincinnati, Partners for a Competitive Workforce, the National Fund, the Social Innovation Fund, and other national funders. The National Fund appreciates their continued support and partnership